Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello and welcome to Sensei podcast. It is a great pleasure and privilege to introduce an amazing interventionalist, a good friend, Dr. Mauro Carlino, who is the co-director of the Cath Lab in San Rafaelle Hospital in Italy, and literally one of the fathers of CTO PCI from the early days and probably one of the most creative people in the field ever. So Mauro, welcome and thanks for coming to Sensei podcast today.
Thank you, Manos. Thank you so much for having me here. It's very exciting to share my story with you, and I'm very grateful that you give me this opportunity.
Now, we're very excited to hear how someone became as creative as you have. So maybe you can get us from the beginning. How did it happen for you? How did you get involved in the early days of CTO, and how did your journey start?
Okay, so first of all, I was born in Milan, and I studied in medicine at the University of Milan Medical School. And I started my activity, my professional career in San Rafaelle Hospital, again in Milan. And a very important turning point in my career occurred in 1998, when completely by chance, when I was 40, so I was quite late, Antonio Colombo decided to move to San Rafaelle, where I worked. And I was lucky enough to have the opportunity to collaborate with him. Up to that point, my experience in interventional cardiology was very limited. But thanks to the opportunity to work with a brilliant and ingenious operator such as Antonio, I had the chance to make rapid progress in a short time, becoming familiar with the more complex procedure. And it's not a coincidence that a few months after the opportunity to begin my activity with Antonio, I published a paper on circulation as a first name about the PROTECT treatment of degenerative saphenous venous graft with percussurgery. Probably you remember it is a device developed to prevent embolization during the treatment of degenerative saphenous venous graft. As you know, in that period, there weren't many opportunities to treat CTO. Only a few stiff guide wire were available in the market with poor torqueability and distal core deformation when the wire is advancing into the calcification within the vessel. So Antonio experimented with new, rather unconventional treatment methods borrowed from percutaneous intervention for femoropopliteal occlusions in peripheral treatment. I alluded to the start. And I will talk about that later. And furthermore, is a boundless scientific curiosity led him to forge a relationship with a lot of foreigner colleagues, particularly with Japanese operator who had begun their pioneering experience in the field of CTO PCI about 10 years earlier. So I had the opportunity, the great opportunity to exchange opinion, experience, point of view, and tricks of the trade with a lot of very important operators, the true pioneer of this field. I talk about Dr. Suzuki, Dr. Kato, and probably you know Dr. Tamai, who unfortunately is no longer with us. Well, it was a fantastic phase of my career where I had the opportunity to learn a lot of things from this master of the CTO PCI. And I remember that when I discuss with them about my technique that, as you know, involved injecting contrast media into the occlusion, they listened to me smiling and with skepticism. However, I was able to learn a lot from them. To be honest, I must say that the same type of reaction also occurred during international meeting I attended in that period, talking about my technique. I remember the first time I talked at the TCT, talking about the contrast guided star. People was very impressed, and probably in their mind they thought I was a little bit mad. But
Which is a common characteristic, yeah, for people who are creative.
Uh, Later, always thanks to the opportunity of cultural exchanges with Japanese groups, I subsequently had the big opportunity to cooperate with Sunao Nakamura, which I consider my Japanese mentor. It gave me the opportunity to try all the novelties of the Japanese market about coronary guide wire well in advance, explaining me with great skill and meticulousness how they should be used. In fact, I was one of the first European operators having the opportunity to use to use the guide wire of the Gaia family, for example. Furthermore, I had the opportunity to go to his cat lab in Japan, in Tokyo, and therefore to exchange our respective experiences in the field of CTO PCI. And by doing this, I was perhaps able to convince a Japanese operator for the first time that my technique could help, and is probably one of the few operators of that country that use the Carlino technique. But this was my starting period. It was absolutely excellent and outstanding.
And then, Mauro, your technique, you told us, that your technique that carries your name. I think actually there's the only technique in CTO that actually has a name. So congratulations. I think you have the only technique, as far as I know. I mean, they're the vernicolates, but yours is the only technique that actually carries your name. So how did you come up with this idea? Was it just the exposure you mentioned? Was it the interaction with Antonio and the other Japanese operators? How did you come up with the idea in the first place?
Well, Antonio, as I told you before, tried to experiment with technique to reopen artery in a period when it was very difficult to reopen artery because there was no devices for that purpose. And the STAR was a technique very important in my opinion. It's full of criticism, it's true, but we must not forget that it allowed us to become familiar with the subintimal space. It was a technique that has changed the operating philosophy in the PCI field, paving the way for all subsequent antegrade and retrograde dissection re-entry techniques, encouraging the development of the more controlled contemporary subintimal technique, including the retrograde cart and dedicated antegrade subintimal dissection re-entry synthesis, such as the Stingray, which have become established into the clinical practice. Only thanks to this technique, the majority of operators have begun to use the knuckle technique, as you know, and which is a safe way to cross long and ambiguous courses of occluded segment, maintaining the guide wire position within the vessel architecture, which means in a safe position. I remember that in those times, when an occlusive dissection appeared, the majority of cases of the procedure was suspended and the intervention of the surgeon was considered, which is absolutely incredible. So the dissection was something that created a lot of fear in the majority of the operator, but Antonio create the opportunity to taking confidence with this situation. Watching Antonio Colombo working, I too began to gain confidence with this technique, and I tried to add something of personal. So in 2008, I published a paper about the so-called contrast guided star. And for those interested in this topic, there is a website called maurocarlino.it where I explain exactly how to this technique was born. Basically, the appreciation that contrast injection into the you have not to forget that there was a dogma at the time. Never inject contrast when you have a dissection. And so it was not so easy at the beginning, starting injecting contrast into the intraocclusional space. Initially, in the setting of the STAR technique, further improved procedural success was I realized that what is a significant advancement of this revascularization strategy. As you know, my initial description involved the injection of a relatively large volume of contrast, more than 5 millimeter, with the aim of providing a roadmap of the occluded segment, which was particularly useful for long and tortuous segments, facilitating the safe advancement of a knuckled wire in a subintimal space, increasing the confidence, the operator confidence in tackling difficult CTO. Occasionally, injection of this large volume of contrast facilitated re-entry into the true lumen. So at the beginning was the purpose to reopen the artery. But subsequently, I have modified this technique with the appreciation that the injection of a small contrast volume, I mean less than 1 milliliter, appear to be equally effective. I have expanded the use of this maneuver basically to resolve fibrous cap ambiguity and just to modify the plaque characteristic, particularly when we have extensive calcification. Advances in technique and increased operator experience have significantly improved success rate in contemporary CTO-PCI. However, even in the most important center, success rate rarely exceed 90%. Therefore, further adjunctive techniques such as the Carlino technique to improve the likelihood of procedural success are still required. And I'm very happy when you publish a few years ago the paper that I call Carlino to the Rescue. Basically, you reported two CTO-PCI cases in which the use of the Carlino technique enabled success after other crossing strategy failed to cross the occlusion. Well, when I read that article, I really realized the importance of the Carlino technique because you made me proud with this work because I realized that with my invention, I've been able to help other colleagues in fixing very important problems. And above all, I help a lot of patients in the world to have benefits in terms of their quality of life having a successful treatment of CTO PCI.
So, Mauro, you've been so creative, right? You've been learning a lot and creating new iterations. Now you have the AFR, you have the Carlino, you have the draft about the retrograde. I mean, literally, once in a while, you come up with these great ideas that simplify our procedure. How do you come up with the ideas? How do you learn these things? How do you imagine them? And how do you perform them?
Well, thank you for considering me a creative. Probably I am because, when I perform a CTO procedure, I think of being inside the occlusion with my mind. And so what I would have done if I would be there, just there inside. For example, when you are in the subintimal space, basically there is a simple, very thin layer separating the true lumen from the subintimal space. And so I try to realize how can I do if I would be there with my body, with my head. I try to create some kind of fenestration in order to pass from a way to another way. And this is very important to be creative, thinking of being there. It's in my opinion, it's very important. When I consider to perform the contrast guided star, for example, I realize the opportunity to inject in the subintimal space, because after a procedure performed by Antonio, I remember he reopened a right coronary artery very well with the star technique. And at the center, we had the evidence of the posterolateral branch and the EVP very well, and before implanting a stent, the stent, he inject contrast, and in doing that, by like a miracle, there appeared a few branches in the posterolateral branch. So I tried to understand which was the mechanism that reopened these branches. And I thought that probably the column of contrast went in the cul-de-sac of the occlusive dissection and break the layer separating the false lumen with the true lumen. So if this happened by chance, I tried to do the same intentionally. So at the time, I went with the microcatheter, where I want to try to reopen the artery, injecting contrast. In doing that, injecting small amount of contrast, I realized other opportunity. For example, I realized that you can get a lot of important information of where you are. Are you inside the main branch? Are you inside the small branches? For example, what I called the stone cloud dissection are a very important signal where you are in a bad position. So you have to recover a good position. And so if you see a stone cloud dissection, it means that you advance too much the microcatheter, and probably the distal tip is towards small branches. So if you continue injecting, it's like when you go, for example, with the cross boss in small branches, the risk of perforation is very high. So you have to come back, you have to pull back the system to inject in order to look for a tubular dissection, which means that you are in a bad position, in a safe position, and so you can continue. So basically, this is the way I create this technique. For example, another technique that you suggest is the draft technique, which is a technique that facilitated the externalization of the wire. The mechanism is basically the same of the integrated fenestration reentry. When you create with the inflation of balloon a fenestration to allow the re-enter of a wire, you have not to forget that this fenestration is a transient phenomenon, and it's like a sliding door. So if you want to pass through the sliding door, you have to pass at the right moment. And again, if you want to pass for an AFR procedure or for a draft technique, you have to do all your best in order to maintain as longer as possible the fenestration opened. Another technique I published was the knuckle of the microcatheter. It seems something of very aggressive, and probably it is. But when you advance with the wire or with the microcatheter with a knuckle morphology of the system, you never create complication. At least you are not in. If you are not in a small branches, you never create perforation. So you can use even the microcatheter, particularly if you are in a high calcific lesion.
Thanks, Mauro. Again, phenomenal creativity and creating all these techniques. But in your day-to-day practice, are you now, you've done so many cases, you have so much experience. Do you get nervous about the cases? Do you get stressed out? They're very relaxed for you. How do you approach your regular cases now?
Well, I always remember that CTO PCI is different respect a conventional PCI. I usually do not enter in cath lab for a CTO PCI case in the same way I enter for a conventional PCI case. It is not the same level of risk, as you know. So you have to be a little bit tense, very focused on the procedure. And because I think if you are, but at the same time, you have not to be too nervous, because if you are too nervous, this doesn't help you. I usually try to go in the cath lab with the right mix of what I can call a controlled tension, which allow me to perform the procedure without being overconfident. But at the same time, I don't want to be too nervous, because if not, this situation do not help, particularly if you have any complication. You have to be really focused on the procedure. And I really appreciate the way you divulgate the CTO PCI. For example, your books are very useful for this. I suggest to all my fellows your books and your paper, because you are systematic. I think you gave to all of us, all operators, even the most important operator, the opportunity to be schematic. So when I have a complication, I think to the page of your book where you were very schematic, but it was the correct way to manage a difficult situation. Obviously, over the years, I became less and less anxious respect the past. But in any kind, I suggest to enter the cath lab with a control tension, because problems and complications are hidden and lurking, as you know.
And as you mentioned, they're part of the daily life. If you do complex and CTO cases, you will have complications. How do you handle those? Do you get frustrated? Do you get angry? How do you handle with complications? Of course, you have tremendous experience now, but how do you approach them right now?
Well, every CTO PCI operator have experience of complication. The importance is to ability to manage the complication. So you have to have clear in your mind what you have to do immediately when some complication occur, because even the best operator in the world have failure and complication. I know that failure can be highly frustrating and demoralizing, especially given the significant effort that you put into planning and into perform each case. But you have to know, reading literature, talking with your colleague about that, what you have to do. It's important to be able to accept failure and learn and apply the lesson that the failure provide you. This is a very critical step of a CTO operator, and because often reattempt cases will be successful. When I have a complication when I am unsuccessful frequently, I try to perform the redo with another good operator, because I want to improve discussing with another senior operator. This, I think, could be a good method to improve. But frustration is normal, but from the frustration, you have to generate a correct behavior, a correct reaction, because as I told you before, the complication is always possible in this procedure.
And Mauro, you have trained so many people, so many fellows in all walks of life that have done phenomenal work. How do you choose your fellows? Are there some people, some characteristics that you find attractive to want to teach someone to get better? What do you look for in your fellows?
I had a lot of fellows. The most, the best fellow I had is Lorenzo. Lorenzo was a very interesting story. He arrived in Milan, in my hospital, and at the beginning he was not sure to perform CTO PCI. At the first moment, we tried to do some structural cases, but talking with me, I was able to transfer him some kind of curiosity, and this is, in my opinion, is very important. I'm very excited when I see fellow working with me having the same enthusiasm I put in my procedure, and this enthusiasm gives me energy, powerful to try to explain them all my tips and tricks. And with Lorenzo was a fantastic adventure, because probably me and Lorenzo were complementary. I mean, I tried to transfer him my creativity. I explained him performing a lot of cases together. What was my method of working, and he gave me a lot because he had a different preparation respect than my preparation. For example, he has a good English speaker respect me, and he helped me a lot in writing my paper about my technique. What is important is the enthusiasm, the true willing of improving. And when I see this, I have no problem in order to give to my fellow all the best.
Clearly, Lorenzo Angelini has done phenomenal work, and you really created an amazing operator there. But do you find some items, some techniques? What is the most difficult thing to teach from what you do in CTO PCI? Is it the wire, the microcatheter?
When I work, I have in my mind the hybrid algorithm, and for me it's very important. The paper you wrote with the other North American colleagues, in my opinion, is a very important paper, because give to the majority of operator rules. So the creativity is important, but is important in a context of a method. And it's very important having in mind what it's written in the hybrid algorithm. So I am very concentrated on that. What is important that the rule that if the procedure stalls for more than 15 minutes, there is no progress, it's very important considering other opportunity. And this flexibility, in my opinion, is what is the reason why the success rate of the CTO PCI increased in a wonderful way in the last year. So it's very important to have a plan in your mind. You have to be conscious that you have to accept the opportunity to change your strategy, because this allows you to increase the success rate.
And then how about keeping in shape? I know that it's a complex procedure. You'll be doing it for a long time. How do you keep fit and strong to be able to do this procedure both physically but mentally as well?
But I have so many enthusiasm, so I don't feel the. I'm not tired when I play. I'm able to stay in the cat lab for several hours. If I am concentrated, the enthusiasm give me a lot of energy. So probably from this point of view, I'm very lucky because I have a good resistance, and my goal is to give to the patient the best in order to improve his quality of life. This do not the difficulty of the procedure don't give me a problem. It's I'm very lucky because I do a job that give me opportunity to gain money and to be happy, like a player of football. The difference is that I can do this procedure even as I am 64 years old, and while a football player can go up to at maximum 40. So I'm very lucky. I'm very lucky because I do a job that gives me a lot of energy and enthusiasm.
And then what are the things you are most proud of? I mean, you've done so many things, but what are the things you are most proud of, both personally but also professionally?
I confess that I'm very proud about the Carlino technique. When I attend a meeting, when I see live transmission with different and difficult cases, I'm very happy when I see performing my technique. And probably in short time we will publish another paper with in the title my name. So will be the fourth time the Carlino technique is quoted in the title. I confess I'm proud about that because I can leave in the future for my colleague a sign of me, something of concrete, and I'm proud also because I I I can leave something significant for my son. The my family for me is very important. I dedicate my extra professional time to my family, and I try to transmit to my son my enthusiasm. I don't know if he will become a doctor, but if yes, I will do all my best in order to transfer him with the same enthusiasm I dedicated to Lorenzo, for example. All thing I have in my mind, and starting from the Carlino technique. I think the Carlino technique is something of util because, for example, as I told before, when I read the article that you wrote about the Carlino to the rescue, I thought about two patients. I don't know their face, I don't know their disease. I only know that someone, in this case you, reopening an artery using a technique I suggest you. For me, this is it's very important. I'm really proud about that.
Inappropriately so. Again, this is one of those things that can really be very handy. Actually, my very first case when I came to Minneapolis was a previously failed case, and I actually was successful using your technique. So that's actually after that paper. So you've done a lot of, you've helped a lot of people that you probably don't know much about them. How about, do you have a favorite book or a favorite movie?
Yes, I know it's strange, but I see a lot of time a movie which is an old movie which is the Rocky Horror Picture Show. I don't know if you remember this. It's a cult movie. It's I like a lot, and frequently I have the CD, and frequently I see this. But I like a lot of movie about adventures, and like I like Italian movie because they are, in my opinion, very nice, very nice.
And how about what excites you right now? What's the next step? What are your plans for the future? Are you plan to continue to work forever? You plan to take a little break? Look like you're in perfect shape, but what are your thoughts about the future?
I hope in the future of having time for traveling around the world, and my I would like to help people in country where there are difficulties to try to improve the quality of the treatment in that country using a simple technique. In my life, all the technique I wrote are a simple technique without need of a difficult device to be used. And even, for example, I think in the future, I hope of having the opportunity to demonstrate that the integrated fenestration reentry it's a very important procedure, and not because I created, but it's an important procedure because it makes sense. I mean, you can consider as a first step of treatment for a CTO, but you can consider without any problem to perform this procedure when other procedure fail. Even when the stingray fails, usually the stingray fails because of the subintimal hematoma. And in performing the AFR, basically you fix the problem of the subintimal hematoma because inflating the balloon, you create an opportunity to the blood to go out. And I think we should overcome the skepticism about this technique, and I think that the skepticism of this of the majority of people derive from the fact that it's a simple technique, and people think that every difficult situation, such as a CTO, must be fixed with a difficult procedure. Not necessary. My topic, my goal is to make easy what easy it is not.
Wonderful. So, Mauro, again, you've been phenomenal in everything you've done so far. What would be your advice for people who are starting or they're in the process of learning CTO and complex PCI? What do you think are the key elements, the key pieces of advice that can help them become a master like yourself?
Well, first of all, it's very important that people have to be sure that the CTO intervention program is for them. I probably suggest what you suggest me a few years ago when you wrote a paper you wrote a paper from the CTO corner of Cardiology Today, and you see, if I well remember, the title was "The Why and How of CTO Intervention." I think in this paper, you concentrate all the elements important to become a good CTO interventionalist. First of all, it's important the commitment. Commitment is the key to going through learning curve of CTO PCI. You know that the CTO operator is committed to help each patient by achieving excellent result, even among very challenging cases. Commitment is very important when facing failure and complication, as we said before, that are common in CTO PCI. Then it needs procedural skills, which are very important and can be developed, refined. We learn in CTO PCI. I think that to do this, it's important that operator have already performing complex in PCI, and they must have a robust technical skills. For example, I think that before starting in performing retrograde procedure, it's very important having all the knowledge of the antegrade treatment. And it's very important, for example, that operator do have to recognize which is the step they have to overcome. They have to start with antegrade, all the antegrade technique, then all the antegrade dissection re-entry. Then you have to consider the retrograde approach using first the bypass graft, then easy septal, then difficult septal, at the last step, the epicardial collaterals. Another important aspect is to improve the overall PCI skills, having a lot of relationship with operator in the same field. Today there is a big opportunity. The internet network allow to maintain every day the opportunity to exchange idea, opinion, and career, and to show our cases to other people. And so today there is a really big opportunity to improve themselves, utilizing all the opportunity that for example, internet give us. When I started, there was no this opportunity. I was lucky because I was in a favorable environment. I mean, I work with Antonio Colombo, which is an open mind. He was a genius and creative operator, so I was lucky. And now I think if you want to become a good operator, you have a lot of opportunity. But the first possibility is that these people have to read your old article, Change Your Die, and the why and how of CTO intervention was for me very important paper. So I continued. I have 2 copies in my study, and I keep them with love. And so I suggest to all my fellows starting reading these papers.
Well, Mauro, again, thank you so much for taking the time today. Congratulations on, again, creating all this broad array of techniques and making our life much easier and our success much higher. And I hope you continue to do so for many years to come.
Thank you very much. And I consider you more than a great operator, a great friend of mine. Thank you.
Thank you. Thanks, Mauro.
Thank you. Bye-bye.
Thank you for listening to the Sensei broadcast.